A stroke begins without warning and progresses with terrifying speed, destroying millions of brain cells every minute, which is why recognizing its earliest signs and taking immediate action can truly save someone's life. In this video, we will clearly explain what a stroke is, how it disrupts the brain, which warning signs demand instant attention, and why your quick response can completely alter the outcome. Understanding what happens during a stroke. A stroke occurs when blood flow to a specific region of the brain is either blocked or interrupted, depriving brain cells of oxygen and essential nutrients. Since the brain cannot store oxygen or energy reserves, this interruption results in an immediate, rapid decline in cellular function, ultimately leading to the death of millions of neurons within minutes. There are two primary types of stroke, and understanding the difference between them is important for recognizing how they can affect the brain and why they require immediate medical intervention. The first type is known as an ischemic stroke, which accounts for the vast majority of cases and occurs when a blood clot obstructs an artery that supplies the brain, resulting in an abrupt and dangerous reduction in oxygen delivery. When oxygen stops reaching that part of the brain, the surrounding tissue begins to fail almost instantly, and unless the blockage is removed quickly, the damage becomes permanent. The second type is called a hemorrhagic stroke, which takes place when a weakened blood vessel bursts and causes bleeding within the brain. This blood not only disrupts normal circulation, but also increases pressure inside the skull and injures nearby brain cells. Regardless of which type occurs, both require immediate action because the brain deteriorates extremely quickly once deprived of blood flow. Every minute counts, and every second allows additional brain cells to die, which is why early recognition and rapid emergency response can make an enormous difference in someone's recovery. Before moving forward, let me ask you something important so you can reflect on your own experience. Do you personally know anyone who has ever suffered a stroke? Or have you seen someone suddenly develop symptoms that concerned you? Why early recognition matters. Many stroke victims lose valuable time because the people around them hesitate, misinterpret the symptoms, or assume the problem will resolve on its own. And this delay often leads to more severe complications or even permanent disability. Since stroke symptoms can sometimes appear mild or confusing, immediate recognition becomes essential, and the most reliable tool for identifying them quickly is the well-known Be-Fast method. The Be-Fast method provides a simple, structured way to evaluate symptoms that could indicate the start of a stroke. Balance refers to a sudden and unexplained loss of stability or coordination, which may cause a person to stagger or appear dizzy. Eyes highlights sudden vision problems, whether in the form of blurred vision, double vision, or the unexpected loss of sight in one eye. Face encourages you to look for facial asymmetry, especially when the person attempts to smile, because one side may droop or fail to move normally. Arms involves asking the person to raise both arms. When one arm drifts downward or cannot be lifted, that weakness can clearly indicate a neurological emergency. Speech focuses on whether the person suddenly struggles to form coherent words, slurs sentences, or has difficulty understanding language. Finally, time reminds you that the moment any of these signs appear, emergency services must be contacted immediately without hesitation. Recognizing even a single symptom from this checklist should prompt urgent action because stroke often presents with only one or two changes. Yet those changes are enough to indicate a serious problem. Let me ask you something that helps reinforce the importance of this knowledge. If someone around you suddenly developed slurred speech or arm weakness, would you immediately call emergency services? Or would you wait to see if the symptoms improved? The critical treatment window. The effectiveness of stroke treatment depends heavily on the speed at which medical professionals can restore blood flow to the brain, and this is why reaching a hospital immediately is so important. The longer the brain remains without oxygen, the more extensive and irreversible the damage becomes, which is why physicians rely on a combination of medication, imaging, and specialized procedures to intervene quickly. The primary treatment for an ischemic stroke is thrombolysis, a process in which a medication known as alteplase, or TPA, is administered to dissolve the clot obstructing the artery. This medication circulates through the bloodstream, reaches the blocked vessel, and breaks down the clot, restoring blood flow to the affected part of the brain. However, This therapy is extremely time-sensitive. It works best when given within 4.5 hours from the moment symptoms begin, and delays can significantly reduce its effectiveness while also increasing potential risks. In many cases, especially when larger arteries are blocked, doctors may perform an advanced procedure called mechanical thrombectomy. During this procedure, a specialist inserts a catheter usually through the femoral artery and carefully navigates it through the vascular system to the blocked artery in the brain. Once the catheter reaches the clot, a specialized device removes or retrieves the obstruction, immediately restoring circulation to the brain tissue. This technique has transformed stroke care by allowing certain patients to receive treatment even up to 24 hours after symptoms start, depending on imaging results and other clinical factors. Both of these treatments are effective only when the patient arrives at a stroke-equipped hospital quickly, which reinforces the importance of recognizing early signals and responding without delay. What you should never do if symptoms appear. One of the most dangerous mistakes people make is assuming that stroke symptoms will go away on their own, or that they were triggered by something harmless, such as stress, lack of sleep, or emotional tension. Waiting even a short amount of time can lead to severe and permanent damage, and in some cases, the delay can eliminate treatment options entirely. It is also unsafe to attempt to drive yourself to the hospital during a stroke, since symptoms like weakness, confusion, or vision changes can worsen suddenly. The correct response is always to contact emergency services so trained professionals can assess and transport the patient safely and begin necessary treatments immediately. This is a good moment for you to reflect on a final question. If a loved one suddenly showed signs of facial drooping or sudden vision loss, would you feel confident taking immediate action? Or would you question whether it was serious? The long-term impact of delayed treatment. A delayed response to stroke symptoms can severely affect long-term recovery, and the consequences may include paralysis, impaired speech, memory difficulties, vision problems, challenges with coordination, emotional changes, or cognitive decline. Many people require long-term rehabilitation and may struggle to return to the level of independence they enjoyed before the event. However, when people recognize symptoms early, call emergency services immediately, and reach appropriate care quickly, outcomes improve dramatically. Many individuals who receive timely treatment regain strength, recover speech, and return to daily life with minimal impairment. The difference between long-term disability and meaningful recovery often comes down to swift action. How you can protect yourself and others. You do not need medical training to be the first line of defense during a stroke. What you truly need is awareness, confidence, and the willingness to take action the moment you notice something unusual. By understanding the Be Fast method, recognizing sudden neurological changes, and calling emergency services immediately, you can play a crucial role in preventing irreversible damage. It is equally important to remain calm, stay with the person, note the moment symptoms began, avoid giving them food or medication, and ensure they are transported to a stroke-capable hospital. These simple steps can literally preserve brain tissue, reduce long-term disability, and save lives. A stroke is a medical emergency where every second truly matters, and recognizing the signs early can completely change someone's future. By understanding how a stroke develops, identifying symptoms with the Be Fast method, and responding without hesitation, you protect the brain from irreversible damage. Your knowledge and preparedness can save someone's independence, mobility, and even their life. If this video helped you, share it with your loved ones, encourage others to learn these signs, and subscribe for more essential health education.